Environmental pollution contributed to the deaths of about 9 million people in 2015. That's nearly 15 times as many deaths from war and all forms of violence. That staggering figure comes from a study published this week in the medical journal The Lancet. Here's Werner.
This guy is going to act like it's breathing with me.
New Yorker Chelsea Yamada is wearing a special vest on her commute, measuring her exposure to air pollution. It's part of a multi-year study looking at pollution hotspots and the impact on cyclists' health.
It's smoky, it's thick, and you get trapped sometimes if you're really in their tailpipe, sucking it all in.
Despite recent efforts to curb pollution, a major new report from The Lancet shows more needs to be done. The study found more people died from exposure to dirty air than from health factors, including obesity, alcohol, and a high-sodium diet. Dr. Philip Landrigan of the Icahn School of Medicine at Mount Sinai.
Most of these deaths are caused by chronic diseases, specifically by heart disease, stroke, lung cancer, chronic obstructive lung disease.
Nearly 92% of the deaths occurred in developing countries, with China and India most affected, and children are at the highest risk. But each year, pollution also kills an estimated 155,000 people in the U.S. Yet the report says pollution can be addressed. In the 45 years since the U.S. passed the Clean Air Act, air pollution here has dropped 70%.
The control of pollution actually saves money because it prevents illness, it extends life, it helps the productivity of economies in the United States and in countries around the world.
Dr. Landrigan points out that the gross domestic product in the U.S. has increased 250% since the Clean Air Act was put in place in 1970. He says that's proof, Rena, that countries can have wealth and prosperity and clean air.
Werner, thank you so much.